Good morning, HIP community. My name is Elisa Orona. I am the Executive Director of the Health Improvement Partnership of Santa Cruz County. It's my privilege to serve in that position. I'm going to start with, of course, a welcome to you all and also some housekeeping items so that all of our guests are fully accommodated. Today's forum features simultaneous live Spanish translation. In other words, the forum is presented in English with Spanish interpretation. You'll see below on your screen an interpretation icon. It looks like a globe. And from there, you can choose the language that you want to hear, either English or Spanish. If you select Spanish, please remember to click the mute original audio. Everyone is muted except for our presenters. And later on in the session, we'll be using the Q&A button to ask questions and to read answers. The forum is being recorded, so please note that. So I was asked in 1 minute to answer the question, why are we here today? And it's been over a year now of pivoting to respond to the COVID-19 pandemic. And we came together knowing that the strength of our partnerships and collaborations positioned us well to better meet the growing health, economic, and overall well-being needs of our communities. And while we could not be prouder of the efforts and the outcomes that we've made, we also acknowledge that there is so much more that needs to be done. The disparities that we witnessed in South County, with over half of the COVID-19 cases in our Latinx community, are unacceptable, and they beg us to examine further the very conditions that continue to exacerbate inequities in our society. Today, we will explore this conversation, and we hope to build momentum to respond together as we head into a more hopeful future. We know that you will be inspired by Isabel Duron and our community panel as they share strategies and pathways to embed an equity lens in our every action that we do as individuals, as organizations, and as a community as a whole. I want to be sure to thank our HIP sponsors. We, of course, are supported by the HIP board member organizations. And we would like to especially thank today an anchor sponsor, the Hospital Council of Northern and Central California. The Hospital Council has supported HIP's annual forum for 6 years, and we're so grateful for that support. It is really a testament to the Hospital Council's mission, which is to make their communities healthier places to live through hospital collaboration, partnerships, and advocacy. So this year, we welcome DeAndre James as our forum moderator. DeAndre is the Executive Director of the Community Health Trust of Pajaro Valley. He has always had a passion and a mission for service and healthcare improvement for the underserved. DeAndre began his career in the U.S. Navy as a hospital corpsman, serving as an EMT and an operating room technician. Before his current position, DeAndre was the Chief Operating Officer at San Mateo Medical Center and Executive Director of the Dignity Health Medical Group. DeAndre is an active participant and member of the HIP Board of Directors. And in a future year, when our annual forum is back in person, we hope to invite DeAndre back as our MC so he can moonwalk across the stage. Until then, DeAndre, you are unmuted and the mic is yours.
Morning, morning. Thank you, Elisa. I promised that moonwalk, that was private conversation. So now that's public and now that's going to be expected. But welcome, everyone. I'm just here really to facilitate a conversation or help us get through the day of an important conversation about how we move past after, being in COVID, as advancing, recovering, and equity beyond COVID-19. So, like, we've had this momentum and we built up this momentum through the whole community, through the country almost. But now, how do we keep that momentum going? And how do we, after we recognize these disparities, how do we move these disparities into action? How do we really say social determinants of health is where our future lies in the world, and these disparities need to be eliminated? But I'm not the one to answer that question, start to answer that question. That's why we have our beautiful keynote speaker, and that's why we have our panel here today. So get your popcorn ready, get your coffee ready, get your stuff ready, get all settled in. I know we're on, Zoom, so if a cat's running behind you, your kid's jumping in the way, it's all good. It's okay. That's what we come to realize. But make sure you're on mute so we don't hear the cat or the dog jumping on you, right? But let's get our stuff ready. We ready, feeling good, get loose, because what we about to hear is what we about to hear. And our keynote speaker today is Isabel Duran. And if you don't know who she is, let me tell you a little bit about who she is. She is the founder of the Latino Cancer Institute, a national network of Latino agencies dedicated to diminishing cancer risk. She's an award-winning journalist, and her current national work focuses on capacity building and racial and ethnic communities. But last but not least, who she is, and this is the kicker, right? She is a role model of strong people across the world, a courageous advocate who wholeheartedly dedicates her time to being an agent of change. So without further ado, I'm going to get out of your way and let you meet Isabel Duran.
Thank you very much, Andre. That was very, very lovely introduction. I really am pleased to join this conversation with all of you, both at HIP and all of you, the participants at this annual forum. With the drop in COVID infections and mortality, the opportunity to vaccinate and lose the mask, many people see this as returning to normal. But if you're taking a serious look at the damage that was left behind, spotlighted and in fact uncovered by this maybe once in our lifetime pandemic, we as a society and as a community can no longer afford to be complacent. A colleague of mine from San Francisco's Mission District, which was equally devastated by COVID, said, we can't go back to normal because normal is what got us here in the first place. And in fact, now is the perfect opportunity, as Andre is pointing out, to admit and explore past transgressions like systematic discrimination, talk about what we learned and how those barriers added to the negative impacts we've just experienced. And today, work toward together to move toward equity and justice. Let me set the table. I spent much of this past year checking in with institutes, cancer agencies, and research partners, community health workers across Northern California, and federally qualified healthcare leaders to try to track down just the impact on cancer screening and treatment for the Latino community. Stories I heard from one end of the country to the other, to here in the Bay Area, screenings for cervical, mammogram, and colon were down 15 to 25%. Some COVID patients, cancer patients, even feared going to the hospitals for fear that they were going to be given COVID. What we know from emerging data from cancer centers like UCSD is that Latinos with cancer were 3 times more likely to die from COVID than non-Hispanic whites. And the American Cancer Society projected that late screenings would result in higher incidence of late detection, increasing mortality and risk, just because of the impacts from COVID. In reality, we saw the same barriers to quality care that existed during the pandemic and before the pandemic. lack of awareness, access, navigation through the systems exacerbated by low income, language, and cultural beliefs, including fear and distrust. All of this drove up impact. Yesterday, I moderated a panel for the World Stem Cell Summit, and a Black colleague from the Minnesota Doctors for Equity Care reminded me, the system isn't broken. It's set up to do exactly what it's supposed to do, make money. It's a business model, not a care model. So that in fact, what we're advocating for is a different system, not putting a finger in the dike of a system that doesn't serve marginalized and communities of color well. Next, please. So apply that to the most vulnerable populations of Latinos and other communities of color as COVID devastated our communities across the country. And you can see just by the dashboard here in Santa Cruz, and as you heard from Elisa, of course, the Latino community, which makes up about 1/3 of the residents of the county, which is about 276,000, they had the highest rates of infection and mortality, matched only by the impact on seniors in residential homes. The reasons, of course, they're essential workers out there every day doing what needed to be done. I heard two immigrant women wrote in an op-ed the other day, the work we do is considered essential, we are not, and normal is not what we want to return to. There, of course, is the crowded housing issues due both to the cost of and the multi-generational families living there. There was the lack of information and understanding of the pandemic, misinformation, disinformation. Like on Facebook, people said, meaning they, the government, or unfriendly and unwelcoming systems, they wanted us to get tested so they could give us COVID. So in Alabama, for instance, Black women were concerned about the vaccine impact on pregnant women, and the youth said, oh no, we're too healthy and young to get sick. Latina women and youth in the Mission District of San Francisco said the same thing. So we're not so different. In fact, we have a lot of alike in which we can work together. And so it behooves agencies working toward similar goals to work together to address each and every issue that drove or sustained the COVID listed here, as you can see. But the question becomes now, what are the interventions needed to change those? Next slide, please. Well, let's take a look from our equity perspective. I would think that even as you and your agencies have been attempting and doing fabulous work as HIP and all of the other organizations engaged, your institution scrambled, as Elisa said, to address the challenges that came with COVID. You heard often from news analysts to CDC specialists to research experts that COVID exposed disparities that had been hiding in plain sight, that you all knew about, been there for decades, and that systems, infrastructure, and inadequate investments in communities were prime causes. We know that, we knew that, it's still the issue. Diversity, equity, and inclusion, that is how it looks like from the view of one community-based organization here in San Jose. There are distinctions between disparity, inequality, and inequity. Disparity, higher burden of illness, injury, disability, or mortality experienced by one group relative to another. And inequality is a difference in health outcomes between populations. Inequity is a systemic difference in health for a specific population that could be avoided by reasonable means. That is where we need to go to get to justice. Equality is the assumption that everyone benefits from the same support that is called equal treatment. Equity is everyone gets the support they need. Justice is all three concede the game here, as you see, without supports or accommodations, because the cause of the inequity was addressed. The systematic barrier has been removed. Next, please. So how to get there? It's not going to be easy. It's a big lift, and it's far from a quick fix. Those of you who have been toiling in the vineyards for many years know this. It's not like this is new, but here's a new opportunity. And it's really important to pull together critical collaborations, as you have been doing. But you have to make sure that everybody's in the game, because you're working on an ecosystem. It's not just about health. It's not just about the economy. It's also your environments. And we'll get to that in just a bit. But you need to work constantly in alliance with your governments, local, county, state, and federal. You need to know who those players are, and you need to be in constant touch. You need to have the support and engagement of all healthcare providers, so there are seamless opportunities to take care of health issues, from the private to the public to community health centers. Care-based organizations or community-based organizations like you are the most critical. You are the glue. You are the ones who bridge between the community and these systems. You are the ones who need to be peer, partner, leader, not the bureaucracy. And of course, we can't forget education, not only about trying to heal the wounds that they leave because they're not doing their job, but you need to take advantage of educators. They need to be in the room with you and at the table, like that fabulous, wonderful university you have up there in that hill, where in Santa Cruz, those people, those professors, they need to be at the table with you making plans about how to address the barriers, the problems, the issues. And finally, who is this all about? It's about communities and families. This is what you are trying to do. Invigorate a community, make it healthy, make sure that it's economically primed to be the productive group that it needs to be in order to have a healthy society. Next, please. So first you have to do some checks, and maybe as community agencies, you have done this. We call it, in the old-fashioned terms, we call it a SWOT. Successes, weaknesses, opportunities, and threats. It's time to pull it out again and take a look at it. What worked during this past 9 months or a year? How did it work and who made it work? What failed and why did it fail? What were the weak links? Where did we find the weak links within ourselves and within our circle of partners? Do we need new partners? Did we bring in new partners? How should this continue? And how do we all together find the dollars? I'm going to have a little bit about that in a little bit. And let's go to the threats, because there are continued threats. You know this, constantly challenged, one, to come up with the money, but the cost and the collaboration, where are the breakdowns and how do you glue those together and move forward? There are lopsided decision-making. Sometimes it comes from the top down, it comes from the bureaucracy instead of it coming from grassroots up. You need to balance those scales. You need to figure out how to address that and be seen as peer collaborators. Lopsided decision-making, community not engaged appropriately. You need to light the fire under the community itself to make them know that they are equal partners in those things which happen at them, that they can be part of the answer and the solution. They are part of the answer and the solution. And we need to address all the culturally, linguistically weak or weakened CBOs this past year because of the financial and the program hits. Next, please. So you need to take an environmental scan. This is the ecosystem you live in. So it's not just health. It is economic stability. You do need to talk about poverty. Look at the employment, food insecurity, and housing instability. Education, high school graduation. Just because you have 2 high schools doesn't mean that they're actually serving what needs to be done to get kids to graduation and into upper education. Language and literacy issues, early childhood education and development. A lot is put on preschool. Do you have that opportunity for some of the lowest income families? This is so crucial to establish children on that proper pathway towards success, a success that can help them come back to the community and be some of those leaders. Healthcare, of course, because health is wealth. And if you're constantly struggling to be healthy, you're never as productive a citizen as you can be. access to those healthcare services, to health literacy, that's prevention, education, et cetera, education, early intervention, community health workers as navigators and bridges to services. Just got some exciting news this morning, if your county doesn't already know it, that Governor Newsom has put into his budget that community health workers / promotoras should be covered, their expenses should be covered by Medicaid. This is really a huge step forward, and I'm trying to get in there and make sure that they don't put obstacles and hurdles in the way that keep some of the currently employed promotoras and community health workers, puts hurdles in their way with certifications and all other kind of requirements that actually eliminate them from this very important, crucial public healthcare workforce. So that's something that you can fight for. Learn more about it. Access to healthy foods. How much did we discover that people didn't even have access to food, that they went food hungry, food insecure? The quality of the housing, crime and violence, which is not unknown in challenged communities of color. The environmental conditions, which is part of where crime and violence comes in. What about access to those parks and exercise and recreation programs? And finally, social cohesion, something that you all are trying to build. Working together, civic participation, civic engagement. Discrimination is what we're all talking about. How does that impact at every single level up the way? I was just even reading an article for business women who are saying that they can't even bring their culture to work, that they're, in order to survive and succeed, they need to act like the whole. And oftentimes the very reason for them to be in those positions and at those tables is because of the diversity, because of their knowledge and lived experience that they bring to help make that business more successful. And particularly because I'd say almost 50% of the population is now minority majority. So we're here to stay. We're part of a very strong economic, global economic turn. And so if our communities are not well and prepared to work and financially stable and healthy, that impacts the whole community. So that is super crucial. And please do not forget the digital divide. We saw how it needed to happen. Telehealth services are now going to be crucially important. And we needed to make sure that all families had access to what broadband, as well as long distance learning, mental health services, so they could reach out, all very crucial. These all are related to the social determinants of health. They are conditions and where people live, work, learn and play. So we're talking about an ecosystem. We're not talking about silos and singular approaches to the issues. You're all in it together. Next, please. So strategies for change. I'm not going to read this to you. I sent the whole infographic to HIP, and I'm hoping that they'll share with you all of the toolkits and tools that I sent to them. But here you see steps to take within the healthcare space and also to address economic and social challenges. You can use this as your guide moving forward. Look at each of them, see how they intersect across these margins from the healthcare space into economic and social changes. We know healthcare is very pricey and that many people put off healthcare because of that. They're not doing annual screenings. They're not doing constant checkups. I would say that think about a kid who has asthma, who shows up in the emergency room all the time, and the docs are saying, hi, isn't he taking his meds? Aren't those meds helping? And it's not the meds. If you do a social scan of the neighborhood where he lives, maybe they're taking the meds, maybe they're parceling out the meds because they can't afford to give him the necessary. So that's sort of out of compliance. But also, maybe he lives in a neighborhood where the pollution because of buses and auto traffic and truck traffic is constant, exposing him. And that is why he's constantly challenged to improve his health. And that will apply to the whole neighborhood. If there are a lot of those issues, you take an environmental scan. Why are these people unhealthy here? Those become policy issues. Know your legislators, know the people who can help you fix it, know how to fix it. talk to the policy developers, talk to the people up in the hill in that university who know how to help you do this. Next, please. I want to show you my toolkits I'm sending you. Here are several toolkits, including Communivax, which I've been working with for over a year as we talk, in fact, as Andre's point, talking about how do we restore not only opportunity, but justice to these underserved and embattled communities. And so we've come up with some plans. We also just released a action plan. It also has points to some dollars where you can find them along, both federal, local, regional, et cetera, et cetera. Also, the CDC has a great tool for putting social determinants of health into action. And then here's a roadmap for health and all policies, collaborating to win the policy marathon. That is your hardest, I think, barrier sometimes. And so you really need to have some experts around that help you get into the game. And that is all I have for you. I hope that this is helpful. You've got some great people leading you at in different organizations. I hope the organizations can cross over, put aside your specialty, and determine that all of this is necessary to address the ecosystem in your community across Santa Cruz County, and that these are going to help you thrive. So now, let's get to the question, because this is very important. Allow families to thrive. Here's the poll. Which of the following equity priority areas would you start with? I've given you a ton. It's a heavy lift, as I said. So take a shot. And while you're doing that, am I supposed to throw it back to Andre here as he introduces the panel, or do I want to go to my next slide? I know I need to go to my next slide while you do the poll. I want to invite you to put on your calendars the October 29th national event that the Latino Cancer Institute is hosting, COVID Cancer and Systematic Barriers to Latino Health. It will be virtual. We will have a Spanish translation. We're going to have 3 hours of engagement around this issue from scientists. Very important to learn where we're at, what we need to do to going forward. So thank you very much. And I'm going to throw it back to Andre now. Thanks.
Hello, hello. Can you hear me?
Yes, we can.
All right. Can you see me? I don't know if you can see me, but
now we see you.
All right, there we are. We're back. Hold up. I want to say that thank you, Isabel. Amazing. There's 145 people on here. Did you hear the challenge that Isabel laid down? Right? Did you hear the challenge? We have to work as a community. We have to collaborate. Let's get our SWOT analysis out, right? Let's get our SWOT out. We are the glue. 143 people. Did you hear that? We are the glue. So let's take a minute, right? And we have our great panel of individuals who are going to say, what does this mean to us locally? What did that gauntlet that Isabel laid down right there mean to us locally? And we have a great panel of individuals who will walk us through that. And if you don't know, let me introduce you one by one. Kat Willis. If you don't know who Kat Willis is, you better find out. She is the founder and executive director of the Tannery World Dance and Cultural Center, a founding member of the Santa Cruz County Black Coalition for Justice and Racial Equity, and the founding director of Black Health Matters Initiative. If you don't know, now you know. Now we have, Maria Cadenas. And if you haven't seen Maria Cadenas around the community in the neighborhood, then I don't know, your eyes have been closed. She is the executive director of the Santa Cruz Community Ventures, has led efforts to create college savings accounts for newborns, and started the great initiative of Undocufund, which is a collaborative effort to provide cash assistance to undocumented workers. But that ain't even half the story, and I don't want to get into that. We can get miles and miles of the story of Maria Cadenas. That is for sure. So I got to keep this thing on just a time limit here. So let's get to the next one. Is Jennifer Herrera. right? And Jennifer, as this is able to say, it's the silent ones that are the deadly ones. Because you haven't seen Jennifer around, but you know her work. She is the Chief of Public Health for the County of Santa Cruz Public Health Division, is responsible for overseeing the county's population-based health interventions, including the local COVID-19 pandemic response. So she's been in your house for the last year and a half, or around in the community for the last year and a half, around equity and collaboration and the core values that drive Jennifer's work. So be ready for that. But last but not least, Steve McKay. And as Isabel pointed out, that university on top of that hill, that's where Steve's at, right? He's the Associate Professor of Social and Director of Center of Labor Studies for UCSC. His work has been around Santa Cruz County, focused on low-wage labor, affordable rental housing, and immigrant and mixed-use families. So we all together, look at this, this is all Fathoms of the World coming together to collaborate and talk about what we need to do for our community. So I'll let Isabel lead this group into this great discussion, and I'll see you on the other side.
I need to unmute. Sorry, everybody. I think that the poll is really telling in and of itself, and it actually says a lot. So I hope that all of you have seen the answer. Thank you very much for pulling that poll up against. So you could see over 56% of them talk about choose economic stability and housing security. But the bottom line is you could take every one of those and roll it underneath this huge umbrella of things that should be congruently addressed and not in silos, because all of these add to a thriving society. So what I would like each of you to answer as your first question, how does your future equity work reflect to the equity priorities that the community just identified? Let's start with Kat.
Can everybody hear me? Okay.
Now I can. Okay, thanks.
Okay, sorry about that. Thank you so much, Isabel and everyone. It's so great to be here on this panel and to be speaking with all of you and to be a part of this community of change that's happening in Santa Cruz County. You know, I just want to start by saying that we all recognize that Santa Cruz County is expensive. Not only is the accessibility to affordable housing is a chronic issue in California, but for Black Americans in particular, the historical data tells us that our population has worked against redlining, refuse of loans to someone because they live in an area deemed to be poor or financial risk, historical and chronic low wage jobs, and encumbered by national wealth gaps. That certainly plays a role for Black residents here in Santa Cruz County. The United Way's CAP assessment snapshot that was done in late 2020 demonstrated that although it may be great strides the average Black family's median income has here in Santa Cruz County, which is around $78K annually, it's about $120K for our white families throughout the county. And even less, about $77K for our Hispanic Latino families. And of course, income does not necessarily reflect wealth or the ability to build wealth. It sounds like a luxury to build wealth, but the key is that that wealth means investment in a child's education, the ability to own a home and create a stable and healthy community to live in, and how that investment over the long term looks like for healthcare and wellness. You know, there's a $45,000 difference between that median income. Where can that $45,000 go? How can it be invested for families? So when we're looking at, you know, how that affects people in a short-term way, yes, we need to make those policy changes so we can bridge that wealth gap. But on a long-term range, it means we're going to see the kinds of results that we want when we're working with policy to make sure that that $45,000 can go along a lot farther for families. And that housing and stability becomes not only a reality of that there's a place for us to live, but that we can build upon that and create wealth in our community.
And even more importantly, Kat, it's actually building that 45K, because, is that a living wage for any family to succeed? So let's go to Maria Cardenas, because maybe she has the answer both to the question and to that comment.
I don't know if I have all the answers for both.
I'll give you a try.
I think in terms of the question, everything that we do at Ventures needs to center around equity. So it's not about choosing and picking which pieces of it we're going to use an equity frame, both in implementation and in accountability on how we measure and look at our work. We like to say that we center our work on love and justice. And if we're honest about the economic components, which I actually agree on the poll, is that the reality is that the cost of poverty is too high. The cost of poverty is too high, and there's no better investment than in creating health and stability by investing in eradicating poverty. And that means explicitly looking at our economic system, one that is predatory and extractive, and that we need to move to an economy that is also centered in love and justice. Because we can't continue the economy that has given us such vast wealth gaps, such vast income gaps. In our county, we have a 30,000 income gap between North County and South County. The average living wage needs to be $94,000. What service worker, what hotel worker, what farm worker is earning $94,000 to survive? So they make do by black markets, by bartering, by extended networks. That burden costs them time to grow in their careers, time to do so many things, and even starting a business because they like social and other capital. I think that when we look at the connection between all the things that you mentioned, Isabel, we have to realize that the financial stability is piece of it. So is education, so is housing, so is health, but they all feed each other. We're currently doing a small pilot on guaranteed income for the undocumented workers that were impacted by COVID. And we're like, we're going to tie connection to it. We say we're going to build them as a cohort so they can get to know each other and know that they're not alone. And then we're going to give them $500 every month. And our hope was just stability. We're looking at, can they have savings? Can they have credit? But the biggest impact that we've seen is mental health, self-confidence. Women who said, I've been working in the fields all my life, and I thought that was what I was meant to do. And now I know I can do more, that I have a choice. A woman who had suffered from migraines all her adult life, who got glasses and learned that that was the only reason she had migraines. It is all connected. And it has to be an intentional effort of making equity the guiding light that goes on program design and implementation and collaboration. And I'm so grateful for the health community here in this county that has really opened the doors to that. We launched the Children's Savings Account program here as an intergenerational long-term investment to create the communities we want, not just to address the gap. And we did it from birth because that's how we can impact early childhood development, which is crucial for academic development. It is crucial for career development. And so we have to be creative in how we do it.
And actually, I just got off a meeting with the Surgeon General talking about her ACEs program. So talking about, toxic stress in childhood that actually puts children on the wrong pathway oftentimes towards success. So it's really something that Santa Cruz County should look into, because it's really a smart thing to look at. If a child is not properly put in the right path to success, then you're going to face all of these other systematic challenges. And it's better to invest in success at an early age so that there isn't dollars pulled away for crime intervention or lack of success on the other end. Anyway, Jennifer, I think she called your name. County Health. How do you feel about what's gone on? What has County Health learned about both? We know economic stability is super crucial, but what has County Health learned about collaboration? Did you shift and change in order to meet the challenges of COVID?
We did shift and change. And for a county health department, it's in our name. We're the public health department. So a lot of times, anything that's community health related, people look to us and people provide us feedback. And really throughout COVID, what we saw a lot more of was, it was a lot of, we want you to do this. We want you to be aware of this, of these disparities, of these issues. But we started to see more of, we want to work with you on this. And I think for me, as a public health director, it made me realize, or made me really appreciate this community, because public health as a concept is a shared responsibility of anyone who is doing work that affects the health and wellness of a community. And so that goes beyond just what we're capable of as a county health department. Really, we have a very specific responsibility to uphold legal responsibilities such as the pandemic response, disease control. We are investing in ACEs, and we collaborated with other community partners to bring the ACEs Aware initiative here to Santa Cruz County. And we work on a variety of interventions that are both downstream, so reacting to or responding to a specific health issue such as the pandemic, but also upstream, so working on the systemic issues such as poverty, homelessness, attachment between children and their caregivers. So we work on these variety of issues, and it's the reality though is that a public health department is just, we're a major stakeholder, but we're just a stakeholder. Really, everyone is involved with promoting health equity in the community. So that was really to your question, Isabel, of how it's really changed our collaborations. It's really thinking outside the box. As you said earlier, we don't want to go back to normal. You know, we want to be better, and that is actually our public health vision. Our divisional vision is better health every day for everyone. And so we're really in this place of trying to think about how do we go beyond what was then into what's to come, and really just, you know, being open to working with folks. And one thing I'll add is it's not just about asking for advice, it's about collaboration. And it's not, what we really need to do as a public health department moving forward isn't just listening to people, but also creating the venues to hear people. So to hear voices of the community and our other stakeholders for community wellness.
So what I'm hearing, Jennifer, is that it's incumbent on everybody to engage in the design going forward. And so that partnership is what is going to yield an equitable answer that everybody can really buy into and drive for. And so I'm going to pull Steve into the conversation, both related to the question about how your health equity work, if they do it up there on the Hill, relates to equity priorities that the community just identified. But most importantly, Steve, I heard you say the other day, we need to be used by the community. We should be there right at, and I totally agree, because I do a lot of collaboration with research. I mean, you bring all of these great design ideas. My frustration always is, but it takes too long to implement them. So make a quick design and then move ahead. But anyway, please join in.
Yeah, so thanks. And really it is, so I'm grateful to be asked to be here. And I think it is really important that the university here in this community is useful to the community. We're a public research institute. But it's what sets the priority of that research. And so the idea that we started this activity with asking our attendees, what's their priority, right? And what was their priority was housing, stability, and economic justice. So we did, and I'm going to put in the chat, a couple of years ago, partly because we have this model, what we call community-initiated, student-engaged research. And the idea is starting the process of deciding, well, what are we going to research with the community, right? And so we ask our community partners, organizations, and community members directly 2 key questions. We start with, what do you know anecdotally but can't prove? And 2, what do you need to know to do your work better? So think about in the COVID pandemic and well before, those questions aren't usually driving research agendas. And so really it's about universities stepping up and asking those questions. So I'm glad to see my colleague Nancy Chen here, who is working with the Global and Community Health Initiative on campus, who has this sort of community-based and community-initiated kind of feature. So our research projects on called No Place Like Home, it was an affordable housing crisis study, which we spent 3 years. And one of the key things is, well, we know that housing's expensive, but how is it experienced, particularly by renters? And so renters were left out of the equation. So we just really didn't know the experience. So we went out and with my team of about 250 students over several years, we interviewed 2,000 renters in Santa Cruz County. And we were able to document that, 70% of those folks are a housing burden, rent burden, right? 50% are that's 30% of your income going to housing. 50% were extremely rent burdened, meaning they're spending half their income. And then we found a category that doesn't even exist in the federal things, people spending 70% or more of their income on rent. And we called it obscene rent burden. So can you imagine if you're spending all your money? So that issue of housing and economic stability being connected is really, really important, right, to understand. And so then our approach to thinking about this, once we were able to document this, is then to think about what's really kind of bringing policy and community into that discussion. And those are the 3 Ps, right? You have to have protection, right, for tenants, because we found very high issues of forced moves and evictions because people weren't able to do it. So you need protection because of overcrowding, protection from eviction. You need preservation of existing affordable housing. We know that a lot of affordable housing is getting, kind of transferred or created, turned back into market rate housing. And the last one is production of actual affordable housing. And that's here where private sector developers and particularly cities and counties need to press for actually producing affordable housing. And as Maria was saying, a lot of this is about taking these kind of decisions out of the marketplace, right? That it shouldn't be a market-led, a business-led model, right? If housing is a human right, just as health is, then we need to have provisions where that takes it out of the market and makes it about a public good.
Let me read. Let me offer you this. No Place Like Home says Jody Gurns or Gum. Sorry, Johnny. No Place Like Home. Amazing research documenting rent problems that needed policy solutions. But let me turn to Kat for this one. Something that I brought up very early in my comments. Where does an organization begin to support staff in bringing their culture to work? Which is kind of curious, right? About, it's almost like you can't leave it at the door, right? And yet there are communities of color workers who go into professional or other systems and feel that they can't be who they are. How do you begin to change that for either for them or for organizations?
I thank you. I mean, I think it comes down to, in many ways, back to some of the work we're doing with, Black Health Matters throughout the county. And that is, really making space for people in communities and their culture. And the more that we make space for that culture and create safe spaces and engagement with our policymakers, with other community members, and through partnerships, that allows people to feel a sense of agency in who they are and bringing their culture to the table. Coming into their workplace and being able to, something as simple as, wearing your hair, like you were discussing earlier, showing up in spaces and being able to fully be who you are. And, that comes down to being in community. It comes down to having a sense of strong partnerships, that support that community and see that community and validate that community. So if the community feels stable and supported, it means that when you go into, your partnerships and you go into your workplace, that you are, really showing, who you are. So yes.
And the organization needs to back that up. I told some of the national tables I sit at that sometimes I feel like the lone voice, that person screaming out in the middle of the room and everybody's looking at her. And it is the leadership who turns and supports that, so that it makes you feel not only that you said something right, but that there is that acceptance of not only you at the table, but the ideas that you bring to the table. So that's very, very, very important for any advocate who wants to, continue even when they feel lonely and isolated. So thank you for that, Kat. But Maria, I wanted to pick up on our second question, because it says, how do we embed lessons learned in the progress that we have made going forward? But first of all, how are you going to measure progress? What does progress look like in the short and the long term, I think? Because we need to sense victory along the world, right? Otherwise we're going, oh my God, we're never going to get anywhere. I mean, I love the descriptions you were talking about with the money that you're giving to see those really incremental changes.
Yeah, and I think that the reality is that this work is messy. It's not linear. It's circular and it jumbles up, and the assumptions you made are going to be wrong, and you're going to have to relearn it. So that's just goes without saying. I'll use Undocufund, which we launched literally within 2 weeks of the pandemic hitting, because we knew we didn't need research. We didn't need data. We have the data. We have the data. We know people in Watsonville were 50% unbanked and underbanked. We know people did not have savings. We knew they were spending 70% on rent. We knew that undocumented people were not going to be included in federal or state aid at the time. So, and that most of them were in service, in hospitality and ag, who were getting significantly hit by COVID. We didn't need to analyze it as partners. We knew we just needed to act. And the implicit importance of visibility and recognition was what led to use the name Undocufund. So it was clear and explicit and intentional who we were trying to help. That's one. We leveraged all our partners very quickly. I can't even think enough how many stood up so quickly to launch this thing in 2 weeks. But our measurement in the beginning, from the very first rough MOU, we said our goal was not only to create the relief, but center it around the recipients and move to ensure that they had more say and ownership in the leadership and determination on how that aid was being distributed. That is a shift on how we look at safety nets. It is trusting people to know what is best for them. Not telling them you're gonna get aid, but it's only for rent. You're gonna get aid, but it's only for food from these vendors, from this gift card. Trust people to live their lives. They are adults. They are adults with self-determination. And so if we can look at internally, what are the steps that we're taking to ensure, again, center love and justice, center the humanity of each of our participants? And for Undocufund, the outcomes were not how many people did we help, how much money did we distribute, which are the basic indicators. And we're going back and actually did a random call phone bank to capture the financial capability scale of the participants. And we're going back to them as often as we can to see if there's movement. And then we introduced them to like, how many touch points can we do in basically microeconomic education? File your taxes. There's a Golden State stimulus, Did you know that there's funeral aid if you lost someone due to COVID that is not impacted by your immigration status? All of those pieces that you can just measure.
Free Uber to vaccine sites. I mean,
exactly.
All kinds of things. But what I'm hearing is there also needs huge investments, and that's not going to come locally. That's going to have to come from the feds and from the state and even from regional, who will push to bring that money back home, because money is going to drive your ability to keep this not just embedded, but consistent. You're going to make a change, but how long can that change last if the money isn't there to help? So Jennifer, and I'm going to put this on both you and Steve, you each have like a minute and a half. But the third question, during the pandemic, how did community members' voices or input influence your organization's accountability? Now, I heard you start that, Jennifer. So I want an answer from you. From Steve, I want you to tell us, how is the university going to show up instead of waiting to be called? Okay, first you, Jennifer.
So just to clarify, the question is, how did the community members influence our investments and the pandemic response?
Influence your organization's accountability to center racial equity and resource allocation and decision making. So that was an even deeper question than I put to you.
Well, in a minute, I guess, I think it definitely has driven how we do the pandemic, or how we acted and how we partnered with folks. I think our equity dashboard, which you had in your presentation, it was shown on the slide deck earlier, that was created, just with the feedback from the community, wanting to see where the disparities are happening in our community. And when we're dealing with equity, there's so much data, and really what we're doing when we're really striving towards equity, we have to identify where the disparities are. And so that's where public health really plays a role, is that we can actually look at the data, analyze it, and report back. But I do want to respect what Maria mentioned, is that we already kind of know the answer. There's been so much research, so much data that shows how social determinants of health have the downstream impact on health outcomes. And so we know which populations are likely going to be adversely affected by COVID or other health issues. And so we can already start putting our dollars and investments and strategies towards those communities. So, even as we were analyzing the data in the pandemic, we kind of already knew where the communities would be most impacted, and started already allocating dollars towards those means. So we partnered with Undocufund. We ensured that we had some of our funding set aside for economic supports. When we had the opportunity to have community testing sites, and community vaccine sites, we centered it in South County, where the bulk of our COVID-19 cases and the effects of COVID-19 were really centered in our community. So data is there, it's important to report out, but it's also, you can still act while we're analyzing data.
Well, it strikes me, thinking about the Mission District example, where there's something like a coalition of 32 local organizations who really did the big lift in the Mission District. And they just recently went back to the mayor, because they moved to the mayor and they moved to the public health department to actually listen to them. And they just went in and asked for $40 million as they want to move towards recovery. So I don't think, Maria, and I don't think Kat, you're going to be sitting there waiting for the public health department to maybe carve something out. I think you've got to have budgets and go to them and say, here's what we need to do, what we have to do. So Steve, how are you going to help them do that? How are you going to give them the talking points, the great little fabulous plan that's evidence-based?
Well, I think this is where it's strategic partnerships. So as Jennifer and Maria are right, we know kind of some of that work, but it's who says it, and this is where I think leveraging the power of the university to be convincing, right? And so this is where if the university starts from the community, then it can lend its support and whatever name and the skills as researchers to make a convincing argument to your funders, to the state, right? But if it comes from the UC, it has a different, kind of legitimacy, unfortunately, than if it comes directly. But if the university is actually doing and working with community to develop that research, right, then it shapes that agenda. So I think it's about a strategic partnership with the university. And this is about holding then the university to account in that sense of where they're prioritizing funding different kinds of research. So for example, we're doing a project coming up that's on the heels of what we've been doing. We're partnering, and previously we partnered with CAB, and we partnered with Community Bridges on a number of our projects. And we're embarking on a new project with United Way and the Youth Action Network, because youth are so central. But we don't know what the topic is. That's because it's about developing the leadership within Yan and having youth determine, okay, what do they need, right? And how do we make that legitimate, what they want to research? So we're going to train them as researchers. They're going to define what that research is going to be over the next couple of years. And then we're going to leverage what we can from the university to look at how research should be shaped by youth in our community, deciding what issues need to be addressed.
So I assume, Steve, that sitting at that table are the youth of color who are up there at the university and who you're helping to become leaders, and you're putting them at the tables so that they will bring those lived experiences and knowledge of the community, can absolutely help shape and form the ideas, the policies, the research. Yeah,
and that's absolutely the idea. Again, as a public university that should be serving more high school students from our community. That's one of these disconnects that I think is shameful, how few folks from Watsonville actually attend UCSC, for example. But our projects are what we call community initiated and student engaged. And the idea is to have engaged students who often have a background, linguistic skills, cultural skills, to be able to collect that data and connect with people, to do it at scale so that we can have larger projects. And so that's one of our attempts. But it really, Go ahead.
Well, no, and that's excellent. So I think that, Steve, the university has to have a plan to figure out how they reach out to the youth in Santa Cruz and create the pathway. How do we
Yeah.
I mean, what are they missing that is keeping them, or is the barrier to them actually qualifying to go to UCSC or any UC, right? Or any public funded college in the, we need these children, these youth to succeed, because they are the future. They're the ones that are going to have to implement these plans all you guys are working on. They have to carry them forward and make them better. So I'm going to have to now pass it on. Thank you very much, Kat, Maria, Jennifer, Steve. It really was a joy to get to talk to you and know you, see who you are, what you're doing. Please forgive me if I'm making assumptions or don't know enough about all of the fabulous work you're doing in Santa Cruz County to ask stupid questions that I didn't have to ask, because you're already doing them. But I do really appreciate spending this time with you and getting to know you. And now I'm going to pass it back to DeAndre, to whom I also apologize in case I left the D off of your name earlier. I'm getting old, see? Getting old. Thank
no
you.
worries. I've been called.
Nice to be here.
I've been said most worse things than Andre. That's for sure. But thank you, Isabel. Thank you, Kat. Thank you, Maria. Thank you, Jennifer. Thank you all. And we had some questions and answers. We will definitely get back to those questions and answers that would happen on there. We just felt like hearing from the people was rich in what they brought to the table. And so just hearing that, just knowing that the work that we're doing in the community is inspiring and great to hear. But we just laid a lot on you. We just laid a lot on you, a lot to think about, a lot to kind of take in, right? And one of my favorite individuals who motivates is Eric Thomas, right? And one of the things he says is, go in a room, close your eyes, take a look, see where you want to go, see what you want to do. And then when you open your eyes, you come out of that room and you attack it every day with the fiber of your being. But somebody who's going to walk us through that piece of mindfulness and mindful activity is Pablo Orisco Castro. He is a member of the People of Color Meditation Group, and a music producer, and as well as an associate clinical social worker at Encompass. Pablo, walk us through the mindful activity.
Thank you, DeAndre. Thank you so much, and it's a great pleasure to be here. Today, I'm going to be doing a brief little meditation to ground us in all the information that we are taking in today. I title this the Grateful Ancestor Meditation. Take a moment and find a comfortable espacio or space to take a pause, sitting comfortably in a chair that you may be sitting on. Calmly rest your eyes or bring them to a soft gaze. And picture a relative, either somebody you know or someone you don't know. And picture that relative hugging you and embracing you. And the relative shares some words of healing and passes on some generational wisdom to you. Tías, tíos, abuelas, abuelos, primos, primas, hasta los tatarabuelos or great-grandparents, aunts, uncles, grandmothers, and cousins. And they pass on generational wisdom through song or prayer, maybe a game or a picture or picture anything from maybe your childhood that one of your relatives passed on to you, and hold on to that memory for just a brief moment. And picture that generational wisdom for you and how you pass it on to friends, coworkers, and future generations. As a river of healing energy flows out of you and your relative as you're embracing each other, let's also give a moment for gratitude for this brief pause. Give gratitude to those who support our health and our mental health and well-being, your ancestors, family members, neighbors, friends, doctors, nurses, all health and mental health providers, case managers, and all of our support networks that have helped us get through this pandemic past year and have made us a resilient community. And now remember that energy flow. The energy flow slowly dissipates and it moves through everywhere you go, and it's always there with you. And now slowly can bring your awareness back to the space that you're in, slowly opening your eyes and taking in the natural light. Thank you.
Thank you, Pablo. Now that we all calm down just a minute, because I know we were a little amped up with what's going on in the community. We're a little bit up. Now we're back in the space. We're feeling great. We're feeling good. We're back in that space. I'm back in that space. If you're not back in that space, let's take a second, get back in that space. Pablo, amazing. It's time to recognize some of our community impact, because you guys have been doing the work, as we remind you. You've been doing that. As Isabel said, you've been out there doing the work. And we want to recognize our Safety Net Coalition clinics, right, in the community impact world, and their innovation, their leadership, the challenges they have faced through COVID. We want to give that, just, celebrate the success, right? You have to take time, to celebrate the successes that you have. So that I want to invite Supervisor Zach Friend for giving us a proclamation of today's day.
Thank you, DeAndre, and thank you, Pablo. I have to say that I needed that at that moment. That was a beautiful, beautiful mindfulness meditation. I really do appreciate that. And it is a significant honor today to be representing the Board of Supervisors to acknowledge the Safety Net Clinic Coalition with a proclamation, but also to say a few words about the remarkable work that all of you are doing. It truly is a collection of the most outstanding and most productive, and truly, I would argue, some of the greatest equity organizations within our county. And for those of you that have worked across the state and the country, you know that this is not a given. Having these kinds of health-related organizations work together as they do in this county to fight for equity and access does not exist at a lot of places across the country. We live in a very special place. I would like to read a couple elements of this proclamation and also just say a couple of personal words. My personal words are, I want you all to know that those are a member of this coalition, and I've said this to our public health team who are part of this. There are people alive in our community right now that wouldn't have been alive but for the work of this group, both through COVID and through other issues. There are people who have a greater life expectancy, but a better quality of life that would not have that but for this organization. You have elevated the voices of those that normally have a seat at the table in a way that is not just commendable, but it really is something that we should all work every single day to ensure is our goal and mission. And I'm just really, truly honored to be a part of this with you, but also really in awe of the work that you do every single day behind the scenes, never asking for any recognition. And to DeAndre's point, we should take the time to ensure that we recognize organizations like yours. And let me read a little bit of this proclamation that is co-signed by Supervisor Bruce McPherson. And one of the things that I think is really important about this proclamation is it acknowledges how many people are served. And sometimes numbers don't come with the same kind of emotion as an individual story, but I think that it's really powerful to hear that more than 1 in 3 residents, or over 90,000 of our local community members of all ages, rely on these safety net clinics for their primary care and other services. I mean, put that in perspective, just 1 in 3 people. And when you also think about how our health outcomes have been outstanding, not just during COVID, but overall in the last few years compared to not just the state and country, if 1 in 3 people are receiving their services through these organizations, that says a lot about all of you and your commitment to their health. But let me also say this, and this is specific to COVID. It says, whereas the safety net member organizations have unleashed new levels of innovation, leadership, and coordination to address the many challenges posed by the COVID-19 pandemic, created new platforms to exchange information in communities with patients, expanding access to telehealth services, and enhancing engagement of trusted community allies, delivering life-sustaining resources. There's another thing that wasn't included in there, and that was the advocacy. I know I heard from many of you during the course of the COVID-19 epidemic to ensure that we were prioritizing those with the greatest need, that we were fighting for equity within our community. And I think that your voice was more than just heard, it was actualized in a way that, again, most communities didn't. It just speaks to the remarkable work that people have done here. I'll close with this final comment here, which is now therefore Zach Friend, myself, and Bruce McPherson, who's chair of the Board of Supervisors, thank, honor, and commend the Safety Net Clinic Coalition of Santa Cruz County and their members for the heartfelt commitment to promote the mental and physical well-being of colleagues, patients, families, and the wider Santa Cruz County community, as demonstrated by your extraordinary dedication and hard work. Today is a day that is dedicated to all of you. My heartfelt appreciation and thanks for all that you do. DeAndre?
Thank you, Zach. It's an amazing proclamation. I couldn't have said it any better myself. I'm glad you said it, not me. But let's hear from some of these individuals on that on that commission. And let's talk to Amy, Dr. Amy McKinte.
Thank you, DeAndre. Salute is part of the Safety Net Clinic Coalition, and we're very proud to have been part of it since 2010. We've been able to see how impactful this collaboration has been, and it's been especially true this past year. We were able to, as a collective voice, represent our patients and make sure that their voice was heard and that equity was at the forefront of the response. As was mentioned, collectively, our organizations take care of 90,000 patients or more in the county, which is a huge portion of the county. And I know that as a collective voice, we're able to implement change better and be more impactful. And we've seen that over the years. We really appreciate being recognized in this way. Thank you. I'll give it back to you, DeAndre.
Thank you, Amy. Well, let's hear from some more of this great representative group, Dr. Casey Kirkhart.
Thank you, DeAndre. Thank you for this recognition. I first really want to recognize and honor the patients that we humbly serve. Those who get up every morning wondering if it will be them or their illness that wins the day. Those who face racism, sexism, homophobia, xenophobia for the simple act of being themselves. Those who go to work every day for their families and for us, wondering if it will be safe or enough. Their courage inspires us and drives us to do the hardest work, to ask the toughest questions, to take the biggest risks on behalf of those who have already done so much for all of us. So after a decade of SNCC and through this impossible year and by this proclamation, it's clear that alongside our private healthcare partners and our county public health heroes, we agencies represented here make up more than a safety net. We are the foundation of community health in this county. We're the bedrock of well-being and the champions of caring, compassion, and equity. Our coalition stands ready as a solid foundation of community health, and watch what we build next. Thanks, DeAndre.
Thank you, Dr. Kirkar. I can't wait to see what you build next for sure. Let's hear from our own Laura Marcus. Laura, you're on mute.
Thank you so much, DeAndre. I appreciate that. And thank you everyone for today's discussion, and such heartfelt things have been said already, and I truly appreciate this group so much. I love what Casey said about our being the foundation of community health. And I think that that was never as evident as it was over the past 14 months as our community struggled to fight COVID. Whether it was participating in planning meetings on how to roll out the vaccine equitably, to sharing ways to limit exposure for our staff and patients, or even just simple words of support from fellow leaders and peers, I know that Juntos could not have made it through this year without our partners in health. And frankly, I couldn't have made it without you. This experience showed the true cost of inequality in our county and in our country, with the social determinants of health a huge factor in people's ability to avoid COVID and access the care they needed. And while we continue to be the foundation of community health, and I greatly appreciate the recognition today, we need to do more and we need to do better to ensure that all Santa Cruz County residents have the social, emotional, medical, and dental care they need and deserve.
Thank you, Laura. Heart, I know that, and that's for sure. And it shows in the community for sure. Last but not least, let's hear from Amy Peeler.
Thank you, DeAndre, and thank you, Supervisor Friend, Board, and HIP for the acknowledgement of our local safety net. There are so many adjectives to describe this era, many words that I would be happy to never hear again, like pandemic and unprecedented. Life changer certainly is a very apt adjective and apt title for 2020 and beyond. Our community, each of our agencies, ourselves, as Laura said, and certainly those we serve, have had their lives changed profoundly, and this is not news to any of you. Our safety net, though, the foundation of true community health, equitable community health, was tested in so many ways with this epidemic, and yet still we found ways to expand, ways to change, and ways to serve the communities that we are here by our missions to serve. As Maria said, we knew we had to act, and it was monumental, and we had to do it in the most organized and strategic way possible. Our individual strengths as agencies, as well as our ability to pull together as one focused group with all of our partners in health, has undoubtedly saved lives. Each action we took, each test, each vaccine, each meeting and visit has reminded us that there is always more to commit to, but that this work is very necessary. And it's an honor to do this work. And once again, thank you. Back to you, DeAndre.
Thank you. Thank you all. Thank you, Safety Net Coalition. Yes, the Community Health Trust is a part of that. And it just feels like we're all family and we're out here in this community. And I love being in this community because it's just us being family, helping each other out. And that's what it's about. That is what's needed. We heard from Isabel today. We've heard from our panel today. It takes us. We are the glue. I'll take that away. We are the glue that makes this change, that make this community great. We are the glue that will continue to push this community and equities and disparities out of existence. And so I thank you for the work you're doing, and I thank the community for just being a part of today and learning what we can do to go forward. And with that, I will leave it to our very own Elisa Arona for the closing remarks of today.
Thank you so much, DeAndre. I so appreciate that. Can you all hear me?
I can hear you.
Okay. And I'm trying to turn my video on. Apologies. Oh, here we go. They've given me permission. Okay. Wow. We've certainly been on a roller coaster of a year, and coming back together again today for our annual forum, it means so much. I felt the emotion. I saw the commitment. We've heard from many of our leaders. I want to acknowledge the leaders within our organizations. We talked about how to help our staff bring their whole selves to work, bring their culture, bring their passion, bring who they are and where they come from to the table. We want to encourage us all to take that action and to think of everyone that we work with as all being leaders in this work. And I couldn't have said enough today how much I appreciate the staff here at HIP who have rallied around this event, made this a tremendous experience for everyone involved from the very beginning, especially a thanks to Sigolén Ortega, Population Health Program Manager, for being the steward for today's event. So very special thanks to you, Sigolén, and the Population Health team, and of course the entire HIP team, which has really grown this year as part of this community's response to this pandemic and to our collective commitments to equity. This shared call to action that I know that all of you on this call and the organizations that you represent share. So here we are moving forward. I want to thank DeAndre for the facilitation, all the energy that you bring to the HIP community and to today's event, pulling us all together. This has been compelling and a timely discussion. I hope it has energized you all to sharpen your equity lens, to think about what your next steps are. HIP is here supporting you all, and we look forward to bringing more of this content forward in the community, all of course in partnership with you all who are doing it and making it real. To the Safety Net Clinic Coalition, it is our privilege and honor to be the backbone, and we are thrilled to be supported again by Kaiser Permanente for another 2 years for our ongoing work. And you have been honored today, and we can hope to continue to honor you as we move into our emergence from COVID-19 and get back to prevention. On behalf of the Health Improvement Partnership staff, our members, our affiliates, we thank you for honoring us today with your presence. We hope that today you leave inspired and ready for the work that lies ahead, and for us all to recommit to embedding that equity lens in our organizations and our work. Thank you so much. Have a great rest of your afternoon and a fabulous Memorial Day weekend as well.
Thank you, Elisa.
Thank you all.